The research that we've been focusing on is really designing interventions to assist patients and their families to live successfully after they receive an implantable Cardioverter-defibrillator, an ICD. And the part of the results I presented at this meeting earlier this morning has to do with the return to sexual activity after a person gets a first-time ICD in their partners. Naturally, people after they get a defibrillator implanted are going to be concerned about different types of physical activity that they can engage in, and sexual activity is just one of those types of activities. And the defibrillator comes with a lot of protections, but it also comes with a lot of worries. And one of the worries is what activities a person might do that would cause a defibrillator shock. So any type of physical activity that causes the heart rate to go up causes a concern about getting a shock, and that's the same with sexual activity. So that was one of the main findings of the study. And then the research really showed that after 3 months go by, that improves and the worries go down. No, it's a legitimate concern, and that is that any time that a person's heart rate would go up based on any sort of activity, whether it be stress or walking, running, any sort of physical activity or sexual activity, there is a possibility that you could get an ICD shock, but it's not a huge one. But of course it would be a worry. Overcome the concern with education and reassurance and helping people and their partners understand how the defibrillator works and what they're really at risk for, what activities will put them at risk for getting an ICD shock. And then there's going to be some individuals that have sexual difficulties that go beyond the relationship to the ICD as a part of heart disease. And so when that is an issue, they need to have a conversation with their healthcare providers about that. But beyond that, we as providers need to do a much better job of providing the education and support so it doesn't always fall on the patient and their partner to be the people that have to initiate those discussions and bring forward their concerns. From the people that came into our study, a little over 300, the sample size that we analyzed were 105 patients that were actually able to engage in sexual activity. So sexual dysfunction, erectile dysfunction in men is a big concern, and it is a sensitive topic. And heart disease definitely, just like it affects perfusion in your myocardial muscle, affects perfusion throughout the body, and not only consequences of the disease itself, but also the medications that are used to treat heart disease can cause difficulties in sexual performance for both men and women. So it is a concern. I think the conversations are really important, and it would even help patients more if providers, both doctors and nurses, would have these conversations before the defibrillator ever goes in. I mean, that would be the ideal situation. Because during hospitalization, it's a really stressful time, and you don't have a lot of time to talk about things. And then you don't often know in that first 3 or 4 month period, people are not sure what they can do or what they should do, and they often don't have enough visits to get back and answer those questions. So any type of education we can do in the pre-implant period would be important. But the people that are going to be able to give the most accurate advice about how to get back to normal activities, including sexual activities with an ICD, are the people who work with the defibrillators: physicians, nurses, nurse practitioners. Maybe general practitioners would have some information about that, but I'm not really so sure. So it's really incumbent upon us to take the initiative and to make the conversation, to get into it as easy as possible for people. If you bring evidence to your practice, there is some evidence that shows the things that patients and partners are concerned about, And there's also strategies linked to help those concerns. And so the literature is small. There's not a huge amount of literature in this area, especially in helping patients with defibrillators and their partners, but it's growing, and there is some evidence to guide practice. And so I would say for providers, use the evidence that you have until we have better evidence. Use the recommendations and the statements that are out there. They're very well developed. They give good recommendations. And, you know, don't be afraid to take the initiative to be the person who just asks the question to help make it easier for your patients and their partners. I think the important message for patients and partners is that their healthcare providers are their partners. And if we know that they're concerned and they have questions, it's good to ask, but we can also help strategize to help them get back to that activity. That's a normal part of living. That's an important part of every relationship, and help them be successful with that and allay their fears, and can also tweak medications to give them perhaps better success. So we want to make sure that they know, and we know, that we're partners in that concern, that problem. So I think the Heart Association's done a really good job of publishing a couple different scientific statements that can really direct providers to help patients more. But we have to get out more education, and also some of the forums that patients might feel more comfortable in having these discussions with our patient groups themselves. So we need to do some more development, put more information out there on the web. I think connecting people electronically is even a good idea. Just different formats than having to show up for an actual visit in the office to get your questions answered. It seems these days that there's lots of other ways that we can get information out that we maybe haven't capitalized on completely.